Good afternoon. My name is Joe Stevens, and I'm the CFO and Advertising Sales Manager for Pursuant Health. On behalf of Pursuant Health, What's Ahead, and audience partners, I would like to welcome each of you to this webinar. We are very excited to introduce to you industry-leading retargeting capabilities that we have currently added to our product portfolio. These solutions are designed to reach precisely targeted audiences based on your brand's specific shopper profiles, and as a result, drive measurable ROI and improve the value of your marketing dollars. At this time, I'd like to introduce Matt Henry from Audience Partners. Mr. Henry is the president of the healthcare practice for Audience Partners, a leading provider of data-driven audience targeting solutions. In this role, Matt oversees strategy, product and business development, and compliance efforts for healthcare clients interested in reaching precise audiences through online channels, which includes display, mobile, social, and video. Digital outreach campaigns focus on acquisition, retention, wellness, and population health for health insurers, providers, and pharmaceutical and CPG manufacturers. Prior to Audience Partners, Matt spent nearly 20 years working for a number of digital marketing consulting organizations, ranging in size from 10 to 10,000 employees. He has started and managed the acquisition of his own web development company, as well as a hyper-local mobile marketing app. His focus during his entire career has been on digital marketing strategy and execution for healthcare and CPG clients, including initiatives for the largest corporations in the world, as well as multiple state and federal healthcare agencies. Matt has a degree in marketing from the Wharton School at the University of Pennsylvania. I will now turn the webinar over to Matt.
Thanks, Joe, and good afternoon, everybody. So, as Joe mentioned, what we're going to talk about today is retargeting, which can mean a lot of different things. We're going to talk about what some of those are. But also data-driven digital outreach, which is kind of the core of what we do and what we're going to talk about today. There is a mechanism on your screen to ask questions, so if you do have questions during the presentation, please don't hesitate to ask. I will answer them as I see them and potentially wait till the end to answer some others, but again, I'd like to keep this interactive, so if you have any questions, please do not hesitate. So I will jump right in. What I'd like to talk about today is a couple of different things. I'm going to start with the basics, realizing it may be review for some, but I think it sets kind of the context for all that we're going to talk about. So really just talking about digital as a tactic in general as part of the marketing mix and how that is necessarily becoming an increasing part of an overall marketing mix. And then specifically data-driven digital. So we'll talk specifically about what we mean when we talk about that. And then we'll get into retargeting, which is, across multiple channels. And as I'll say many times today, what we believe and what we have seen is when you can synchronize multiple channels of marketing around the same audience, you will get better results. And in many cases, you will get more measurable and more attributable results. Then we'll talk about some use cases and case studies for merchandisers. We'll talk a little more about measurement and attribution, and then we'll talk about what's ahead. Unintended. So first, just a little bit about the shifting media landscape. So again, this is probably not a surprise to anyone, but again, it underscores kind of what we're going to talk about today, and that is that traditional media consumption is declining. And by traditional media, I mean lots of different things, some of which you see here. Direct mail is one of them, traditional print, newspaper, radio, broadcast TV. As you can see on these very small graphs, the trend for most of these is down. In fact, in the bottom right, the only upward trend you see in radio is Pandora, which I would argue is digital, not traditional radio. Concurrently with this, every digital channel, the consumption of which is increasing. And by different channels, I mean things like smartphones and tablets and computers of different types. So as you see, just the difference between 2010 and 2014, each one of these has increased by a significant number. Obviously, tablet by the highest percentage because they didn't exist in any meaningful way in 2010. But mobile and tablets in general are representing the biggest part of growth, just with regard to where people are spending their time and consuming content and peripherally, of course, then consuming advertisements of some type. So this slide shows kind of the same data in a different format, and notably, a couple years ago, digital passed television for the first time in terms of share of voice, so to speak. How much of the media consumption hour is spent across each of these channels. So again, radio is declining, print of different types are declining, additional channels under other are declining, but digital, fairly consistently, is increasing year over year, and in fact, as of a couple years ago now, exceeds television in terms of how much time people spend just viewing the medium. So again, I say those things just to kind of set the context to what we call data-driven digital. And before I get into some of the specific things that we can do with data-driven digital, I'd like to talk to you about what I mean, because sometimes I'm 25 minutes into a conversation about it and people have questions or misunderstandings about what it is and what it isn't. So we'll kind of start with this. This is a slide that one of our co-founders created when he founded the company in 2008, and this was a famous cartoon, I believe, in the New Yorker. It says, "On the internet, nobody knows you're a dog." And that was 1993, where there was certainly full anonymity. Well, in 2016, it's a little bit different. Now, in the context of Edward Snowden and in the context of Apple and the FBI, I want to make it clear that all the things we're talking about today, while they are targetable based on specific and known attributes, there is no personally identifiable information of any kind involved. So whereas I may know in this example that you are a male, age 50 to 54, married with 2 children in college, a certain profession and income level, a certain geography, and we can also collect opt-in data, must be opt-in for healthcare usage, that you take Claritin for allergy relief. This is a sample of 7 of what could ultimately be thousands of targetable attributes in 2016. So we know very precisely who we are communicating with, and when we serve ads, we can do so in a very precise way, so that only the people who fit a very specific profile will see the ad. So obviously, in the context of the people on this call, the optimal customer is defined in potentially many different ways within your organization, but certainly across your organizations. There's a different definition of who's the right customer. The good news is we have thousands of attributes that we can use to define them. So again, internet users are no longer completely anonymous. We do not live in the world of personally identifiable information. So we don't target people based on their name or their phone number or their email address, but we do target them based on known attributes. Obviously, PII, personally identifiable information, is involved at some point as we build these cookie pools and IP addresses and mobile device mappings. But for targeting and measurement purposes, it's really just a basic set of attributes that we're targeting. So again, things are very different, and they get more precise really as every month goes by. A few years ago, there was a book written called The Filter Bubble, which did a very good job of explaining kind of how the internet works in terms of personalization. And it's not just content. So the example here says if you search the term Barack Obama on Google from 2 different computers, you'll get different results than the person potentially sitting right next to you, and certainly different than the person living across the country. And those results are filtered on lots of different things, in this case in the Google algorithm, that determine what your political ideology is, where you live, what your occupation is, etc. This will start to filter the results on Google. And indeed, advertising is no different. So the majority of the advertisements that you see on the web or on a mobile device are delivered to you based on some set of attributes that is known about you and or inferred about you based on information. That could be product purchases, it could be web behavior, it could be opt-in surveys, all of these different things that we'll talk about. But the idea is what you see will be very different than what the person sitting next to you will see, because you are very different than that person. So this is the concept that we would then apply to how to reach the right people with specific types of advertising and retargeting. So the platform that's used to do this is very different than what things looked like even 5 or 6 years ago. You can still, of course, go to CNN.com or go to ESPN.com or WebMD.com and tell them that you'd like to purchase homepage advertisements or advertisements that are shown next to articles about XYZ. That's still very much a part of the digital advertising business, but the majority of the digital advertising business, and in fact an increasing percentage every year, is done programmatically, which means this. On the left side, you see data. In the context of my company, Audience Partners, we've got different types of data. We've got proprietary data that we collect. I mentioned healthcare, ailments, and prescriptions, so we can collect that. That must be opt-in to be compliant with HIPAA and to be compliant with online privacy. We also collect product purchase history and purchase propensity, which we build using models, which say, here's someone who's more likely to buy and respond to an offer on a mobile device or on a tablet, or an offer of this type, which is a coupon or a sweepstakes or some different promotion. So this is another vector that we can build in when we build an audience profile. Then we talk about your data, and when I say your data, I mean CRM data. So this could be loyalty cards, it could be a sample of previous customers, it could be survey data that you've collected, and we can do two things with that. We can either match that through a patented process to an online audience so that you can then address that audience very directly through digital channels. This happens to work very well in conjunction with things like direct mail. Or we can model this audience. And again, we've got 17,000 attributes that we can use during modeling to say, if these are your best customers, these are people who tend to buy product X, what are the attributes which define those people, and how can we find more people that have those attributes? And then there's online data, which is really third-party data. Lots of people have gone to great time and expense to build databases of demographic and gender and ethnicity and things like that, so we leverage that as well. But the idea is in aggregate there are thousands of attributes, as I've mentioned. What we do is we enable this data online through things like cookie pools. Every computer has them. Even when you clear them, they come back. Mobile devices have them in a different way. We can target anonymous mobile device IDs, and we also work with 7 out of the top 10 cable companies to target IP addresses, again, in an anonymous way. So we never see the IP address because the cable company owns that information. But essentially, we translate this data into those formats so we can target different devices with ads based on those attributes. That data is then integrated with what you see in the middle, which is a bidding platform. So rather than go to ESPN.com and say, we would like to buy an ad when you're talking about a certain type of product or a certain type of something, or we like to reach men age 18 to 34 and we know that they look at this type of site, we don't do that. What we do is we say, we're looking for people who have this set of attributes, and that could be billions of permutations ultimately. And when we see them in real time, if they are on a site or a mobile app that is considered both brand safe, of course, but also performs well based on our historical information, then we will bid on that ad in real time and we will serve that ad. So it can build pricing efficiencies, but certainly the key value proposition here is precision. And that ad that match is made in real time. And that's what you see on the right. An anonymous audience that is defined by attributes that is targeted across any screen, which includes traditional display, pre-roll video, mobile, social, and also addressable TV, which I'll spend a few minutes talking about a bit later on. So again, I've mentioned thousands of attributes just to give you a couple of examples of what these may be. They come in categories, obviously. So lifestyle, media habits, meaning how do you spend your time on a mobile device, on a tablet, on a PC, etc. Online activity could be things like search retargeting and what things do you search for and what sites do you visit. Again, this is all done anonymously. Responsiveness is something that we factor in pretty heavily as well. Meaning, do you respond to what type of offers? Do you tend to click on ads? Do you tend to download coupons? Do you tend to redeem those coupons? Again, then economic obviously would be drivers. We have a lot in pharma and healthcare. I'd mentioned opt-in, ailment, and prescription. We have lots of survey data on attitudes and opinions. How do you feel about certain medical conditions or diets? Are you active or are you inactive? Would you like to change that fact? Geography obviously plays a big role as well. Spent a lot of time talking about that today. Certainly in a retail environment, that becomes very important. Demographics are always important: age, occupation, income, children, etc. Geo-fencing I'll talk a little bit about later, and then product purchase I think is the most pertinent category to this group. So it's category of purchases. In other words, do you buy over-the-counter allergy medications, as one example? Favorite brands, which allergy medication do you tend to buy? Recency and frequency of purchase. Do you buy things multiple times a month? When was the last time you bought something? Favorite retail locations. Do you shop at Walmart? Do you shop at some other location? And then a couple of models that I had alluded to before that we build, which speak to purchase propensity. So it's one thing to know that you're interested in these products and that you shop at these locations and that you are near these locations geographically, but do you respond to online offers? And what types of offers do you tend to respond to? So again, you can imagine as we combine all of these attributes, we can be very precise. And the result is, first of all, a significant reduction in waste. So you're only serving ads to people who are interested and have a propensity to buy your product. But again, the precision is there, and we can play with lots of different combinations of these attributes to find out what's ultimately moving the needle, which is driving purchase behavior. So there are thousands of these attributes that we can use. An example of what this actually looks like in an online environment, and certainly many of you have seen things like this. So my wife and I this was actually a while ago given the headline here, but we're sitting in our living room, each with our own computer. We went to the same website. We each saw a different ad. And this talks about the subtlety of difference in advertising. So she plays tennis, and she buys tennis equipment online, and she searches for tennis things. So she saw an ad for Babolat, or Bobolot, I don't know how you say that, she does, which is tennis gear. I had just recently, at the time, run the Broad Street Run in Philadelphia. I tend to buy Nike products. I purchased them online, so I saw an ad for Nike. So very similar sort of category of ads, but different brands, different sports, et cetera. Literally, my wife and I were sitting next to each other at the same time, and this is what we saw. So again, as you surf the internet, you are seeing ads all the time. Most of those ads are served to you based on some known attribute. It could be your age, your geo, demographics, or any of those other things that I've just mentioned. So now a word about privacy. Privacy is paramount to everything that we do, and we certainly run into situations where people get a little nervous about using data like this and serving ads, and it's certainly important to be aware of. So again, as I've mentioned before, all targeting is done to anonymous and aggregated online identifiers, which could be cookies, mobile device IDs, and blinded IP addresses. No personally identifiable information is used for targeting purposes. It may be used in order to generate these anonymous online identifiers, but it is not used for targeting purposes. So particularly in a world where Apple is fighting with the FBI over access, privacy is a concern, just want to make sure we don't conflate some of the issues in the news with some of how this is done. Because again, all of this is done on an anonymous basis. Specifically for health-related conditions, HIPAA obviously has a lot to say about that, but online privacy says that no targeting can be done based on a specific and sensitive medical condition, that's the quote, unless there is opt-in permission. So the industry has agreed that there are certain things that are specific and sensitive, and there are certain things that are not. An example of something that has been kind of deemed not a specific and sensitive medical condition are things like the flu and seasonal allergies and things like that. And indeed, we do lots of work in that space. Obviously, on the other end of the spectrum would be things like arthritis and Crohn's disease, which we can work with, but that must be opt-in to do. So certainly when we're talking about OTC and CPG, most of those conditions, headaches, for example, allergies, are not considered by the industry to be specific and sensitive, and therefore we can serve those ads without opt-in permission. That said, just because we can serve to a specific audience doesn't mean we should. So what shows up here is number 2, when it should say number 3, is that the context of ad placement, ad messaging, and frequency of ad impressions is very important. So we never want to create the impression of intrusiveness. We never want to have someone ask, why am I getting all these ads for product XYZ? Because that could have the opposite effect of what you're intending to do. So we manage all of this with messaging and frequency. There are people who do this well. There are people who do this not so well. So that's kind of context for what I want to talk about as the core of the discussion today. We're going to talk about it broadly as retargeting. But retargeting can mean a lot of different things, and I'm going to go to this next slide a couple of times in this presentation. But really the idea here is to leverage data to reach customers across multiple channels. So what we have found, again, hundreds and hundreds of times in campaigns that include not just digital outreach, but some form of offline outreach as well, is that when we can synchronize the messaging across the same or similar audience using multiple channels, we can drive reach and frequency, which is important to build awareness. We can move the needle on awareness. We can also move the needle on engagement, which could be clicks or coupon downloads or something like that. But ultimately, what's most important is we can move the needle on purchase. So again, if you can find the right audience using data and reach them across all of these different things that you see here, the outcome of the campaign will not just be better, it will be measurably better, because we can measure with precision all of the things that I'm going to talk about. So what you see on this screen in the center is a database, and that then empowers multiple outreach channels, which include the 4 screens I talked about before: a mobile phone, a tablet, a computer, and a television, social media outlets, Facebook, Twitter, Instagram, and then on the right side you see things like email, you see direct mail, you see freestanding inserts, and then I have the Pursuant Health kiosk because they have data. They can certainly reach a certain audience in the retail locations where they're located, but we can synchronize that data with many or all of these other channels, and the idea is the audience that you see there on the bottom is now exposed to your messaging through multiple channels, including those channels that they use most. That will differ depending on the individual, so the idea that you can reach them across multiple channels is always effective. And then you see an arrow coming up from the audience, meaning we learn from what we do. We've done thousands and thousands of campaigns, so we understand very much consumer behavior and purchase propensity online, but we learn with each campaign, so while we can start with the ball in the green, so to speak, we can get the ball in the cup very easily once we see how people are responding to a specific offer. So again, when we talk about retargeting, it means lots of different things, but it's essentially taking an audience who has been exposed to your advertisement and then exposing them to a similar advertisement across different channels. So where are your customers? I won't read this entire slide to you, but essentially the theme is that there are many different outreach channels, including television, email, direct mail, FSIs, and multiple ways to reach them through digital. Each of them has benefits and limitations, and rather than read all of these to you, I'll just make the point that that is certainly the case. So the idea is not just include all of these or as many of these as possible in your outreach, but to understand which combination and which mix of these tactics will drive response in which consumer segment and for which product. Well, the good news is in anything digital, and in fact, including when we do offline outreach as well, all of this is very measurable, but more importantly, attributable. So once we do these, and we have done hundreds of these, we can go to a merchandiser and an advertiser and say, you have one advertising dollar. Here is the best way to spend it across all of the things that are available to you in terms of marketing, and the recommendation is based on actual measurable results. So some examples of what this looks like. Again, we certainly work in conjunction with email campaigns. Pursuant Health certainly does lots of email campaigns. We certainly work in conjunction with direct mail campaigns and television campaigns and things like that. But the core of what we do is digital. So in this case, what you see is display. This gentleman that you see there on the left is not being shown this ad because someone went to ESPN.com and said, oh, I'd like to find, millennials and, show them an ad when they're on ESPN because that's where I think they'll be. Rather, we have identified a profile, in this case a very simple one, a male, aged 25 to 30, who buys Scope mouthwash, and we can get this through a variety of sources, including MasterCard purchase data, loyalty purchase data, custom CRM data, all of these different things. We've identified this gentleman as a coupon responder based on a model that we've built and based on prior campaign response, and we've identified where he lives with some precision. Now here it's a zip code. As you'll see in later slides, we can define that proximity as a radius around the store with great, almost scary sometimes, precision. But the idea here is, again, that we didn't purchase this ad from ESPN. Our platform identified the right audience, and when a member of that audience clicked on this site and an impression was made available, in a few milliseconds, the decision was made to serve this ad up. So what you'll see here is not just that ad, but also on his mobile phone. And again, we can do lots of things with location on the mobile phone. But this is a very basic example of what we're talking about when we talk about retargeting, when we talk about data-driven audience targeting. Another form of retargeting comes from email campaigns. So I had mentioned that my company does not do email campaigns, but many companies do. And it is a core outreach tactic. So what we can do in conjunction with email is, in this case, Pursuant sends out an email sponsored by a specific merchandiser. When a prospect opens the email on a web-enabled browser, so this won't work on certain types of email clients, there is a cookie dropped in the browser. It identifies the person as not only being on the email list, but as someone who's opened the email and therefore a hand raiser. Now, when this person navigates the web, they will see, like you saw on the last slide, an ad for scope in this case, and will be able to click, and in this case it's the Walmart site where they could actually purchase the product. It could be a landing page where there's a coupon downloaded. It could be lots of different things that they're driven to. And again, this is just one example, because this is just one piece of data that we use. In this case, the additional piece of data is that this person was on an email list and they opened an email. One of many things that we can use, but it really enhances, again, kind of the surround sound that we create around consumers. Another form of retargeting is geo-fencing. So individuals, this is where it gets a little creepy, so bear with me. Individuals can be targeted based on their precise current physical location as well as their precise previous physical location. So if you've got an iPhone or an Android, no doubt you have multiple applications that are open. Unless you kind of flick them closed, they're always open. At some point on many of those, you have agreed to enable location services, which in some cases are mandatory or at least necessary for things like weather. What's happening with those location services is they're being collected, and again, all of this is anonymous. No one can identify an individual, but a device can be identified so that we can say the following. If you'd like to send an ad targeting people, and this would obviously be on a mobile device, who are in a physical location at a time, let's say in a Walmart, then you can do so. That is how you've defined your audience. Ads will not be seen by anyone who does not fit that criteria. So there may be a few, there may be many, but if there are a few ads will be served. But again, it's based on a very precise, within several feet, location of some kind of anchor. Pursuant Health has a kiosk that is in retail locations, including Walmart's. We can anchor around that given the nature of the kiosk. So if, for example, you decide to purchase some signage on or around the Pursuant Health kiosk, we can identify people who have been within several feet of that. So again, this identifies an audience that has been exposed to your ads in a retail environment, and we can then find them out of the store on a digital environment. So again, we can find people who are currently in the location and serve ads to them. We can also define people who have previously been to a location. So show me people who have been to the Walmart pharmacy 4 times a month for the last 6 months, or anyone who's been there in the last 3 weeks. So these are the tools that we can use. And the last bullet point I have here, we can filter out employees of location A because those are the people who are there every day. But the idea is if they're exposed to your product or to your marketing in a physical location, we can identify them as such and then reach them across devices wherever they happen to be, when they're at home, when they're somewhere else. We've identified them as a valuable audience based on their physical location, either currently or at some point in time. I had mentioned lookalike modeling. This is another form of retargeting. So typically the way that we do this is we will take some kind of CRM list, which could be loyalty club members or people who have responded to some type of promotion, and provided to you during that time some level of information. Street address is best as a match key. Things like phone number will work. Things like email address will work as well. But what we can do with this is 2 things. One, we can build an audience to match this audience so that if they're on your list, they will see ads. But oftentimes what you'd like to do is prospect beyond that list. So what we do in that case is we take a list of who you believe are your best customers based on most likely some purchase behavior, and we will model them against all the attributes that we've talked about before, to create a lookalike model, and we serve ads only to people who share those attributes. That's what the lookalike is. We then develop what we call act-alikes through campaign optimization. A lookalike is someone who shares attributes, and act-alike is someone who engages in the same behavior. So once we see people responding, whether that's a coupon download or a purchase of some type, we can then include that in the model and refine the model to include act-alikes. And in many cases, most cases, this works very well and really moves the needle because, again, we're eliminating waste and we're only focusing on a digital audience that shows some eligibility and some propensity and interest in purchasing your product. And then another form of retargeting, yet another form, is addressable television, which I touched on before. It's interesting. The first time I heard about addressable television was sometime around 1997. I was talking to someone from Comcast, and they'd identified a way to track clickstream data from the remote control and serve ads based on all the information they could have about a household. And the technology was there in 1997, but what was standing in the way was privacy. The privacy groups have signed on, and there's again, verifiable ways to make sure that audiences are anonymized. So the privacy issue has been solved, and the only reason that this is not the only way people buy TV right now is that the cable companies and the networks have not figured out how to charge for it, because when we talk about wasted impressions, that's not necessarily a bad thing for the cable companies because they get paid either way. But I assure you, as I've watched this and worked in this business for the last several years, this is a very quickly growing trend. So the idea is the same. Rather than going to some cable zone or to some network or to some cable company and saying, I'd like to buy millennials or I'd like to buy this cable zone, you can now let much more granular data define your buy. So if it's some type of lookalike model or some type of CRM list or some type of opt-in list, people who have bought or are interested in product X, we can now, on a household level, serve different advertisements. So to make that clear, when we talk about addressable television here in this fictional Main Street neighborhood, all of these households, all 5 of them, were watching the same show on the same night on the same channel. Based on the attributes of that household, they can now be served different ads. So the early adopter for addressable television was auto manufacturers, for example, Volvo and Audi, who have a very good idea of types of people who buy their product. Now, many of them are placing the majority of their television buy only into the households of people who are likely to buy their product. So as you think about the products that you sell, there is certainly some type of audience or demographic or behavioral attribute which defines people who are likely to buy your product. You can build much more efficiency in a television buy by only serving the ads to those households. And again, we're seeing this grow in 100% plus every year. I believe that the political elections of 2016 will be an impetus to make this grow very quickly. And I would say a year from now, if you are buying television, this will become a core tactic for what you do. Currently, about 30% of U.S. households support this type of advertising. So anyone who subscribes to Dish or DirecTV, Cablevision, which is up in New York, and certain areas in Comcast and Verizon Video on Demand, again, can insert an ad on a household level based on the attributes known about that household. So you can think about the power of that, combining the power of television in general with the precision that was really never available before a couple of years ago. This will be something that will be very core. So I'm showing this slide again, as I mentioned I would. I've shown you a bunch of different ways and a bunch of different tactics that we can do. So mobile devices, tablets, PCs, televisions, lookalike modeling, all of these email, all of these different things. But the idea is the same. If you have a central set of data that defines an audience based on some level of attributes, and those attributes are the ones that define the people who buy your product, then you can, through multiple channels, find the same audience. And again, in some of the examples I've shown, people who have seen the digital ads in the Walmart store, on the Pursuant kiosk, we can note their location, find them on Facebook, find them on their mobile device, etc. If you have a direct mail list or you're doing FSIs, we can synchronize those audience audiences. That's not always one-to-one, so that we understand the people who are going to be getting these things in their mailbox are also going to be getting these things on their tablet and on their mobile phone and on their Facebook account. And again, we can build attribution around this so that we know with $1 to spend, you want to spend 15 cents here and 15 cents here and 10 cents here, because your audience will act differently based on segmentation. But all of this is very measurable, and again, this is the core premise of the day, is that really just surround your audience with advertising and find them in the places where they consume media. So we'll talk about some use cases and case studies right now. First, just kind of a simple use case, which I've already touched on before. So Pursuant does lots of different types of in-store promotion. They have a kiosk in pharmacy environments and retail environments, et cetera. There is digital signage on the top of the kiosk. There are ads that are served on the kiosk itself. So you sit down and you get your blood pressure. You are essentially a captive audience, and you are exposed to different types of ads. Through our partnership with Pursuant, we are able to capture that audience in many cases, if they opt in to the Pursuant program, so that we can then reach them through different channels. And if they were in proximity to the kiosk, we can do some things with Geo-Fencing to identify them as someone who has been near that kiosk and therefore exposed to those advertisements, so that we can reach them with advertising. So I picked Mucinex. I did that randomly. That is not someone that we are currently working with right now, but this is just a for example. So the idea is that a certain audience, and certainly across thousands of retail locations, there will be ultimately millions of people who are exposed to these advertisements. We can reach them in store through XYZ. We can reach them out of store through a different set of tactics, but the idea is that it is the same audience. So when you can focus your advertisement across the same audience, you increase reach, you increase frequency. This then moves down the sort of traditional engagement funnel, marketing funnel, and you can ultimately increase purchase behavior, which, as I'll talk about in a few minutes, is all very measurable. But again, these are just additional channels, so this is retargeting. You target them the first time in the store. You can now target them when they're at home, when they're at their friend's house, when they're at work, wherever, through a variety of different tactics. Here's a case study that we did for a flu. This is an OTC flu medication, which is why I used that as an example before. So we use a lot of different types of data here. So I've talked about data a lot and thousands of attributes, et cetera. For this specific campaign, we used a couple of different pieces of data. One was geographic, and we looked at it in two ways. One was zip code level flu prevalence maps. And there are a number of sources that you can get this type of information, but the idea is that in any given flu season, it travels a very specific route, and that is measurable. And a lot of the OTC brands really follow that when they talk about how they target people. So we use that as one data point. As another data point, we use proximity to specified retail locations. So not just zip code level data, but are they within an X mile drive from one of these retail locations that we've identified. We combine this with audience data. So that included things that I mentioned before, like category purchasers, people who purchase flu medication. It included what we call conquesting. So we used survey data to find people who had purchased competitive products to this specific flu medication and targeted them. We also targeted coupon responders, since in this case it was a downloadable coupon to be redeemed in the store. And we also targeted store preference because, again, we were targeting proximity to a specific set of retail locations. So a combination of these things led to us targeting ads, in this case on mobile devices, and ads were only served to people who fit the specified profile. What we saw and what we could very easily measure was a 14% sales lift for the test retail locations versus the control retail locations. Obviously, during flu season, there's lots of marketing activity. We normalized for all of that, and the only variable was this digital extension, in this case on mobile phones. So we could see very clearly a consistent lift in actual purchase data, or purchase activity, I should say, across the campaign. A similar campaign was for a baby food manufacturer. So in this case, for geographic data, we used proximity to a specified retailer. This was, again, limited to a specific retailer. The audience data here, we used demographic data to find mothers of newborn children. We found people who were interested and had a history of purchasing specific types of products and specific brands of products using that purchase data. And again, here we use coupon responders. And then the ads were served on mobile and desktop devices, but again, only to people who matched this profile. Here the results were a little bit better, about an 18% sales lift for test and control retail locations measured up to 30 days post-campaign, and a 42% lower cost per redemption of the coupon versus a concurrent direct mail campaign. So to put that in perspective, you can serve many, many, many targeted digital ads for the price of a stamp. We don't recommend replacing direct mail because direct mail still works, but what we found when we supplement direct mail, the results can get measurably better, just as you see in this case. So measurement and attribution, which I've talked about a little bit so far. Again, everything we do in a digital environment is very easy to measure, so there's a couple of different categories of that. One is really just dashboard level reporting. So this talks about things like how many impressions were served, and how many people clicked on those ads, and how many of the people who clicked went to the landing page, and did they spend time on the site, did they download the coupon, did they watch a video. We can track a lot of this activity. So this is dashboard level reporting, and it can be sliced and diced in lots of different ways, by audience segment, by creative ad, by geography, by all of these different things, which then in turn become the ways that we optimize the digital campaign. These reports are delivered weekly, and they really are just kind of an idea of what has happened in the previous week, and it gives us things that we can optimize towards. More importantly, we can do deeper levels of measurement and attribution. So not just how many impressions and how many clicks. Those are both interesting, but we're more interested in sort of the effect that those impressions and clicks have. So we can look at conversion and redemption analysis. Obviously, this requires some data feedback from either the retailer or the manufacturer, but we could certainly do that. So we can figure out redemption rate and cost per redemption. We can do surveys to indicate a lift in awareness and a lift in intent and a lift in actual purchase behavior. We can also, and this is really where the real effect of these types of programs is seen, is we can identify an exposed audience, and we can identify an unexposed audience, and we can watch the purchase behavior of each. Again, this requires some feedback on the retail side or on the transaction side, but again, we can take a look at anonymous audiences and through a trusted broker, connect that with real-world purchase behavior, whether that's loyalty cards, et cetera, so that we can say, here are 1 million people who saw the digital ads, and here are 1 million people who did not. And we try to normalize those audiences so that that's the only variable, and then we observe the purchase activity between them. And again, consistently, across hundreds of campaigns, when we can add digital outreach to other forms of outreach and exposure, whether that's FSIs or mail or in-store promotion of some type, that we see a lift in cash register activity, which is ultimately what we're all looking for here. So then just a few thoughts on kind of what's ahead and what's next. Really, I just have kind of one slide on that. And hopefully that image is coming through for you guys. I was having some trouble with it before. A couple images here, and I'm going to start with a story that I think about in the late 90s. I remember seeing a television news show, and there was a bunch of teenagers in Japan, and they were playing games on their mobile phone. And I thought, that's really dumb. Who would ever do that? Fast forward now 15 years later, and of course, I do that, and everyone does that. And the point there is that technology evolves. So I think one area that's going to evolve significantly is the notion of wearable devices. I happen to be wearing a Fitbit right now, which is kind of a crude example of a connected device that captures data. We've already seen with the Apple Watch, we will continue to see different types of devices that not just collect data of different types, but also add different ways to execute ads. So what you see on the bottom right of the screen is a screenshot from the movie Minority Report, also about 15 years ago, where many times during this movie he'll walk by a kiosk or he'll walk by a bus stop, and it will cater an ad specifically to him. So what may seem like science fiction is definitely moving that direction. So the general point is more sources of data and more channels through which to present those ads based on that data. And as we talk about wearable devices and mobile devices in general, this offers retailers many more options to find people at the point of purchase so that they can serve an ad, and I'm making air quotes right now about an ad. It's an alert that comes up on your Fitbit or on your Apple Watch when you're walking by the Cheerios, because some data that's been collected on you indicates you as someone who might be interested in Cheerios. So we can get much more personalized. The privacy and security are very well evolved parts of this business, but will continue to evolve. And not only will we be able to collect more data in an anonymized way, we'll be able to execute on that data and serve ads based on that data in a more intelligent way. So when I think about what can be done today versus 5 years ago when I started with audience partners, it really is remarkable. So when I think about the next few years, I think it's things like this that will really drive. But the core value proposition is the same. And I'll go to this slide one last time. The idea is that there is data assets available, and through them you can reach your audience through multiple channels. And when you do that in a synchronized and intelligent way, you can move the needle in a measurable and attributable way in terms of awareness, in terms of engagement, and in terms of product purchase. So again, this is the core belief for our company. We have seen it work thousands and thousands of times. The idea is know who your customer is, find them where they are, and ultimately drive them through the sales funnel to purchase your product.
Matt, thank you so much. Very informative. This is Alex Patterson with What's Ahead. I am the head of sales for the agency. And for those of you not familiar with What's Ahead, I'll give you a brief introduction. We are a marketing agency located in downtown Bentonville, and we offer suppliers a very unique and exclusive toolbox of in-store tools where suppliers can leverage advertising to reach their potential Walmart shopper. So as part of our in-store toolbox, we have partnered with Pursuant Health to bring you advertising programming available on the Pursuant Health kiosk. As such, we wanted to offer a couple of special promotions as part of this webinar. One of them is just an overall kiosk promotion. So if you take advantage of this opportunity, we will deliver 4 weeks of merchandising, which is extremely valuable. So as you see there, you would get Sidekick merchandising available on the kiosk. And we would also include some in-store digital advertising on the billboard, which is located above the kiosk. And then, as Matt talked about, we can also pull in some of the retargeting solutions as part of this particular promotion. We're looking at $115 a store versus our regular pricing of $140. So we think it's a great deal. Hope you will take advantage of that. The other promotion we would like to talk about is a retargeting solution. So very specifically, we'd like to be able to bring you the opportunity to potentially test and learn a retargeting program. So being able to bring in any of the potential solutions that Matt talked about, we would be excited to partner with you on. All of our programs are based on a CPM basis. So the special promotion we're offering is an $18 CPM versus a typical $25 CPM. All of these programs, these discounted programs, are available through March 31st. So we need you to reach out to us and let us know that you're interested. You can see our contact information there, sales@whatsahead.com. Just pop us an email and we'll be happy to answer any questions or put together a custom program that's right for you.
Okay, so that is all we have. We're right up here at the end of our time right now. And I thank you once again for your time here today. You will all receive an email. We are recording the session, so you'll have the opportunity to download it. Certainly can contact any of us with any questions that you have. And thanks again. We look forward to hearing from you soon.